This is an audio-visual representation of a study published in the Journal of Bone and Joint Surgery in 2024. Infection is a common complication following high-energy open tibial fractures due to contamination from both the injury site and the hospital environment. However, a limited understanding of the types of microbes associated with surgical wounds can hamper efforts to control infection. To address this issue, researchers conducted the Bioburden study to characterize the pathogens present in high-energy open tibial fracture wounds at the time of definitive closure or coverage. The study enrolled 646 patients with high-energy open tibial fractures from 39 trauma centers across the U.S. between October 2011 and May 2015. Tissue samples from fracture wounds were cultured to assess bioburden at wound closure and during revisions. They found that 32% or 206 of the wounds had a positive culture at the time of closure or coverage. 75% or 154 of these positive cultures had a single genus identified, while 25% or 52 had multiple genera. Gram-positive cocci or GPCs were found in 47% or 98 of cultures, with staphylococci being the most common, 64 or 31%, and the majority of these were primarily coagulase negative or CONS. Enterococci were identified in 13% of the cultures. Meanwhile, gram-negative rods or GNRs were found in 49% or 100 of positive cultures, with Enterobacter 39 or 19% and Pseudomonas 21 or 10% being the most frequently encountered. Interestingly, most of these pathogens are resistant to the antibiotics typically recommended for prophylaxis during surgical wound closure. Among the 174 patients who required subsequent reoperations for deep infection, 89% or 154 tested positive for bacterial cultures, of which 45% displayed bacteria from multiple genera. With staphylococci persisting as the predominant fracture wound pathogen, GPCs were identified in 134 or 87% of cultures, while GNRs were present in 100 or 65% of cultures. The findings of this study indicate that bioburden in high-energy open tibial fractures often comprises multi-genus pathogens, of which many are resistant to typically employed antibiotics. Understanding the microbial profile during wound closure can guide antibiotic treatment for lower extremity fractures, possibly reducing deep surgical site infections.